Laura, can you hear me? If you're talking, you're muted.
Hey, Tim,
Hey, yep, I can hear you.
no echoing,
What's that?
there's no echo,
No. Can you hear me?
I can,
Nope, I don't have an echo. So as long as you keep the other one muted, you should be fine.
okay, thank you,
Yep, not a problem.
have a good night,
You too.
bye.
Bye.
Okay, let's see here. It is 4:30, March 22nd, 2023. This is a regular meeting of the Dubuque County Board of Health. We'll begin with roll call. I am Adam Hoffman.
Here.
Amy Pro-Sunley here. Patricia. Lemcule, sorry. Patricia Lemcule is here. And Sandra Larson here. So we do have a quorum here in the building. Are there any members on Zoom? I don't believe so yet. Are there? Okay. Okay, welcome everybody. It's good to see everybody. At this time, anyone may address the board on matters of which are on the agenda tonight. Please raise your hand if you're on Zoom, if you'd like to speak, or if you're in the room, please raise your hand and we'll call on you. When you are called upon, state your name and your home address. Individual remarks are limited to 3 minutes. Do you have anyone that would like to say something about something that's on the agenda? Seeing no one, then we will move on to the chairperson announcements. Update on strategic planning. We are making great progress. Ally had a request for proposal out there, and I think that closed this past Friday. And we had was it 5 or 6, 8 companies that were interested, and we've kind of pared those down. The committee has pared them down to 4 that we're going to interview on the phone or virtually. And we're setting those up for later this week and early next week so that we will have a company chosen by, I think, the end of next week to get started then with our strategic plan. A couple of things I'd like to call to everyone's attention. First of all, board members that are here or that are on virtual, congratulate yourselves. You selected just a wonderful person to be the director of the health department. That's Ally White. She's just doing a great job. I think she's only been on board maybe 3 months. She's just making a lot of changes that are going to be important to the health department and to Dubuque County. But one thing I'd like to call your attention to, she did a newsletter. And it's called Community Health Connection. And it's posted on the website, on the county website, and where our health department website is. Very important information here. So hopefully you'll get to take a look at it. And then you can also on the site sign up to have it delivered to your inbox every month. So
We're working on that.
or you're working on
Hopefully
that.
soon.
Okay.
Yeah.
All right. So that will be set up soon. Then one other thing that's still on my mind, HPV vaccine is cancer prevention. And I'm not sure what the legislature, if they passed the rule about you can't talk about HPV in schools, but I know it's before them and they're working on it. So if you have a chance to contact your legislator, please contact them and let them know that HPV vaccine is cancer prevention. And then lastly, I'd like to announce and acknowledge that our assistant health director has resigned. Laura McCarthy Cone, who I've just recently started pronouncing her name correctly. I apologize for that. But Laura is, she has resigned and she's going to be starting something new, I think, out in the community. Is that a new business or? New business. New business. And do you want to say what the name of it is or anything?
It's a jewelry store.
Okay.
It's hot jewelry or hot carrot.
Okay, and that'll be here in Dubuque. Great. So kind of exciting for
To seeing
Laura.
all of you there.
With our checkbooks, right? Yeah. So that's exciting for Laura. We'll miss her. She came to us as a clerk at a very, I think, difficult time. It was during the pandemic, and then she advanced to be the assistant director, and that was also during a very chaotic time, I guess I would say, in the department, where And she did a good job and she really did help us out. So I wish you the best of luck in the future and we'll see you at the jewelry store. I believe Laura will stay with us until mid-April, is it?
April 14th.
And in the meantime, I think that Ally is going to be working on taking a look at the job description and seeing, and we might at some point set up a small committee to work on that. You think you're ready for that right now? You want a committee? Who would be interested in working on the job description for the assistant director of the health department? Anybody?
Well, do we want to do that now or do we want to do that as part of the strategic planning process?
Well, it depends upon how long you want the position open, I guess. I think strategic planning is going to be important in helping to shape that, but I'm not sure we want to keep that position open. Because the strategic plan, best case scenario, won't be finished till the end of September. So. Does anyone help? Okay. So.
I mean, I can be on the committee. I just wondered if we wanted to table it till.
I think maybe just
Find out
get started, at least. You might not want to finalize it, and then there'll be some discussions about how soon the position should be filled and things, so. Okay, so we do have a committee, started then, it will be Amy and Patricia with Ally. Okay, good. So I believe that was it for my announcements. Next, we have Board of Supervisors, Board of Health Liaison Comments by Ann McDonough, Supervisor.
Yes, hello, everyone. Good afternoon. And I don't have much really. I just wanted to draw to everyone's attention the invitation from Representative Eisenhart to a listening session on public health. Maybe you're going to be discussing that under new business. It's this Saturday. I've been invited, just like probably y'all have been. It's just an email kind of blast thing, but maybe there could be some discussion today about if anyone from the Board of Health or the County Health Department is going to be present. It's listening, so it's not as if I don't think you're going to be participating. So it conflicts with, I have family visiting, so I'm not likely to be able to be there myself, but so I'm with you tonight, and let me know if there are any questions. Thank you, everyone.
Thank you. Yes, I got that email. Did you too, Ally? And I know Amy did. Everybody got one. I personally cannot be there either. So Amy, I know you're thinking about it or something. So is anyone else able to go on Saturday? I think it was from 10 to 12.
I'll be there, but on behalf of Hillcrest, probably.
Okay.
Other listening or making some remarks.
Okay. Well, if you get a chance to put in a good word for the health department. All right, very good. Next, we have the approval of the agenda, tonight's agenda. Do we have a motion for that?
So,
Second?
I'll second.
Thank you. It's been moved and seconded that we will approve the agenda for March 22nd. Those in favor say aye.
Aye.
Those opposed? Motion passes. Next, we have the approval of the minutes from February 15th, 2023. Is there a motion to approve those minutes?
I move we approve the minutes from February 15th.
Thank you. Is there a second? Thank you. Any discussion? Hearing none. All those in favor of approving the minutes from February 15th, 2023, say aye. Aye. Motion passes. Next, number 7 on the agenda, presentation and reports. We have a report, the Health Department monthly update from Laura McCarthy and Ally White. Laura, you want to go first?
Yeah, thanks. First of all, Bailey has completed already all of her septic tank septic home inspection. Yes, thank you. Got those done and out of the way quite early. And last month's meeting, Sandra, you had asked us to check into possibly doing PFAS testing with the tests that we currently do for with our grants to county. And we did some checking into that. And First off, it's not a test that our lab is equipped to do. So it wouldn't be as simple as like our bacteria tests that we do in-house. The samples have to be sent to the state hygienic lab in ice packed coolers, so that they arrive at proper temp. The cost of a single PFAS test is $370. That would be in addition to the $160 that it already costs us to do the tests that we do for, through the grants to county. And then just other things to consider, like, the time, additional time that it would take to collect the sample. It has to be, a controlled sample, so you collect in one bottle, you pour into another. The water has to run for 10 minutes. For now, we're like in and out of a house in, you know, a matter of 5 minutes kind of thing. But just information for you to, you know,
Right.
put together there.
Did you happen to find out if, is it covered by grants to counties at all, or they're not doing it?
And
It's current, no, it's not.
because it,
Correct.
because it does have to go into the lab.
Okay, thank you. That's important information. Thank you for getting that.
You're welcome. Ally, Bailey and myself had met with, Eric and John from the Water and Soil Department to discuss how we can, combine our information on water testing. And they have asked us to put together a database of our test results from, FY 21 and 22. And, they've been putting theirs together, and we'll get that information to those guys who will combine it with the database that they've already started. And then these guys will meet again to see how we can, you know, what the next step is, you know, in getting that out to the public or available to the public. And that's all I have.
Can I just ask you a question? Is that digitizing project finished, you know?
Oh, no.
No.
We still have a team from Sedona working to sort through files and putting together a database of addresses and parcel numbers. I'm honestly not sure where the Board of Supervisors is with the next step on that.
Okay. All right. So, but that's all working in-house. That's going forward at least.
So far, yes.
Okay, all right, thank you. All right, now Ally White, do you have a report today?
I do. Are you able to pull it up, Lauren?
Yeah.
Thank you. So you can go to the next slide if you don't mind. Thank you. And I'll start by saying, I think Stacy, you're going to talk about some of this too, so I'll kind of just go over it real quickly, but it's been 3 years now since the pandemic began, and we're starting to see some of that begin to unravel and kind of hopefully put that behind us. So I wanted to just paraphrase the few changes that are happening at the different levels. So on the federal level, I apologize, that's kind of small to read, but the public health emergency is set to expire on May 11th. So that's nationwide. And then what that means for the state of Iowa is positive test reporting will cease. So currently any positive tests that go through any medical laboratories are required to be reported to the state. They recognize that there's so many in-home tests that aren't being reported anyways, that information is not as valuable as it was some time ago. In addition to that, the COVID-19 website, I believe, will demobilize beginning April 1st as well. You can still request free at-home test kits through the state lab. Those are the tests that you give your sample at home, you mail it into the state lab, and then they'll text you or email you with your results. And Medicaid is a program that was kind of grandfathered in during the pandemic. They took a break on reevaluating eligibility, but now that we're nearing the end of the public health emergency, participants will once again be required to renew their eligibility. One of the things that I included in the newsletter, because those participants will get mailings that are required for them to complete the required eligibility paperwork and send it back. So I think just making sure that the word is out there, that that's an important step for these people so that they don't risk a gap in their coverage. Locally, then we expect that we will return to pre-pandemic surveillance, reporting, and data sharing practices. In a nutshell, COVID practices will follow those of other respiratory illnesses such as influenza. Our Visiting Nurse Association will continue to offer vaccines under that emergency use authorization. Is that correct, CC? Okay. And then, of course, we'll continue to recommend following the current CDC. The isolation guidelines as of today are still in place. So if you could go to the next slide, Laura, it's just a recap, and this is going to be directly off of the CDC's website, but I find it to be accurate, helpful, and easy for people to read. So they're still saying, if you test positive, stay home for 5 days and mask for an additional 5 days, in a nutshell. Anytime that we have any kind of sentinel event or pandemic, we want to look at what went well and what could be done better. And that is called an after action report. And so that first bullet kind of talks about what it is and why we do it. Our local team partnered with a consulting company, Emergency Preparedness Consulting, and they are walking us through the process of completing this after action report. And that is nearing completion. I would expect to have a report or some recommendations available at the next Board of Health meeting. Our department is partnering with other public health agencies in the community. So the 5 at the bottom, we've come together to form a steering committee on our next community health assessment. This is something that's required of local public health departments and of hospitals alike, though they're on different schedules. Hospitals need to do this every 3 years and health departments every 5. We've decided to come together and kind of stay together as a community and follow that 3-year cycle. So surveys will be, it's open now, but we'll be advertising over the next few weeks here to try to get as many citizens to complete that survey as possible. We talked about the newsletter already, Sandra.
Thank you for doing that.
Oh, yeah, no worries. And then Public Health Day on the Hill. So I had the opportunity to travel with some colleagues on February 28th to the Capitol, where we were able to just connect with colleagues, and there were some nursing students and that sort of thing there. Connect with our legislators and discuss some of the topics that are making their way through the funnel. Sandra, one of them was the HPV vaccine that you had talked about. Yep. So good opportunity there. And then a couple things just that we're continuing to work on. I know it had been mentioned that the Board of, or I'm sorry, not the Board of Health, the Health Department and the Board of Health make a connection with our local food policy council and establish ways in which we can work together. So we have had one meeting, very productive meeting, I would say, and we'll continue to move forward with that. The soil and water is what Laura had mentioned, that we're working to kind of combine the data from our water testing with the data from their water testing. And next week, I'll have the opportunity to attend my first ever public health conference in the state of Iowa. So I hope to have lots of good information to bring back to our community.
Thank you very much. Any questions? or directed? Okay, moving on then, we will have VNA's monthly report by Stacy Killian.
Good evening, everybody.
Hi.
So our regular report has been submitted in the packet, and kind of like I did last month, I'm gonna highlight some of the services we did provide. And that's not some of the trends and things that are going on within our agency. So taking a look at our services that are being provided outside of the city limits of Dubuque and throughout our county. We provided 3 children with lead testing. We provided technical assistance to 4 child care centers, even offering a medication administration training. We are continuing with our WIC clinics. Right now we have one in Dyersville every single month. We will be expanding those to some of our other communities as well, hoping to get maybe one in Cascade and Farley or Piasta area, just to get more patients served without having to travel inside the city limits. Our maternal health is continuing to grow. We have 13 patients that are out within our counties. We're serving 5 patients in Ryan White that are outside of the city limits of Dubuque. We've vaccinated 66 children and provided 98 service contacts throughout the county. We're continuing to serve 4 individuals for homemaking home care aid, 3 families for parent education, and we did Medicaid informing on 27 children and provided 2 children and 1 adult with presumptive eligibility for Medicaid. So these are all, some of the highlighted services that we do inside of Dubuque City. Looking at some of our trends, first, it's grant season is what we lovingly call it at the VNA. So most of the grants are starting to roll out. Right now, we have initiated the Tobacco Prevention and Control, which is one of our contracted grants. We have initiated that application and are working on it. It is due April 12th. The immunizations I-4 grant was released, and we have that application initiated, and that is due April 20th. And our local public health services grant was just released yesterday, and that is due on April 21st. So the BCC and Wise Women grant, we typically see those a little bit later, so that's not uncommon. But we are continuing to kind of watch and see what other grant opportunities are being released through Iowa grants. I know Allie and I have talked about that a few times to see if there's something that might benefit the health department and the Dubuque community as well. As Allie mentioned, I'll also be attending the public health conference next week, so hopefully it's a good conference. This is my first time in person since COVID, so I'm excited for that. And I am super excited to announce we have several new staff. So first we have Emerald Fremelt. She is a new RN that will be starting with us April 3rd as our family planning coordinator. So she's coming to us from Sedgwick, and I think she's very excited and very passionate about families and women's health and things like that. So I think she's going to do a wonderful job. We've got training set up for her immediately, and so we can kind of hit the ground running with family planning. We just recently hired a new case manager for our Ryan White program, Michaela Onken. She is actually an intern with us right now and will be moving into a full-time case manager position on April 3rd as well. And I finally can announce we hired a home care aide. So just one, we still have a position open. We're still looking for more. But Tina Tiggis actually started with us Monday. And so she's in the process of being oriented and training. Our current full-time home care aide, Delora, is still on medical leave. She returns back Tuesday, thankfully. So we'll actually have 2 because we currently have 80 individuals on a waiting list. And it just continues to grow. So hopefully now that we've got more staff in there, we'll be able to start bringing that down a little bit and get more people services. And like I mentioned, the position is still open. We're still recruiting and we'd still like to hire more, but at least it's a step in the right direction finally. So very excited about that. Tina comes to us with a lot of homemaking and home care aid service experience. And so she'll be able to start that orientation and breeze right through it and be able to start serving patients right away. So we're very excited over that. Okay, as Allie mentioned, there were some COVID changes at the last meeting. I think it was decided that our IMT weekly report, which was our VNA stats, I would provide monthly. So moving forward after this month, I will include it with my packet as an extra page in my board packet. And then the PowerPoint I would typically do, I'll be doing quarterly, but because there's a lot of changes, I thought it was worth just putting it in here because I don't know what type of data I'll have available after April 1st. So threw in just a couple of things. Right now, we are at a low community level, which is a little bit different. We've been at medium for a long time. I will tell you, we are starting to see cases rise a little bit. But it's at a low right now. So we'll just take that win as we have it. Our vaccine rates, I did put this information in, and Allie has this PowerPoint that she can send out to everybody after the meeting. We're sitting around a 64%. Our vaccine rates, you know, we really are still seeing small amounts of people coming in for vaccines each week, probably just a handful. But we are continuing to offer our Friday clinics from 8 to 4:30. And recently on March 14th, they expanded the eligibility of the COVID bivalent booster. So children who have received the primary series of Pfizer ages 6 months to 4 years are now eligible to get the bivalent for that age group. And so if it's been at least 2 months since their last dose of the primary series, they're eligible. So as soon as this was announced on the 14th, we set forth to make sure that anyone coming into the agency knows that we can offer this, and all our nurses are trained and ready to go. So it's nice to see a little bit of an expanded eligibility for it, and kind of happy to see that. As Allie mentioned, the public health emergency will expire May 11th. The Biden administration made that announcement on January 30th. So you've probably seen it in the news. It's just something that, you know, to really keep in mind, and it causes a lot of confusion. One thing on the next slide here, Laura, I really wanted to highlight is the end of the public health emergency will not affect vaccine measures. We will continue to offer the COVID vaccine. We will continue to distribute it through public health for right now. We don't anticipate any changes there. Our EUA will remain in effect, and we'll continue to move forward just as we've been with our monthly distribution of the vaccine to the medical providers. The temporary reporting order, that is what is ending on March 31st. So a lot of the data that we've shared in previously, there will be no DOMO like Allie mentioned. A lot of the data, because it's not a required report of this disease, we're not going to have a lot of that data, but I don't know how accurate most of it is at this point anyway. Allie touched on that. It's really, you know, at-home test kits are being used so much. I'm not sure that we're ever really seeing what's accurately out in the community anyway. But we did just want to highlight some of that to make sure that it was known that we will get some reporting through the Iowa respiratory surveillance reports, a lot like we do influenza. And so I will share those quarterly as what I would have normally shared here. I just don't think it'll be quite as extensive as what we have now. The COVID test standing orders, the Test Iowa at-home kits, those will go through the end of the year. So those standing orders will expire December 31st, 2023. So we will continue to give those out for anyone that needs them. Again, we really don't do a whole lot. We aren't really releasing a whole lot of those, but they are available both through the health department and the VNA as well. And then I think my last slide there is just where we're at with our vaccines. As you can see, I mean, the month of February, we only gave 28, which is half as much as January. Pretty expected because there hasn't been an expansion in eligibility, but we will continue to offer. We did decide to stop doing the Monday evening clinics for now. If we start to see demand rise, we'll go back to adding in additional clinics as needed, but we will continue the Friday walk-in clinics, most likely through the remainder of the year or as long as the vaccine is available to the public. So I think that's it.
Thank you, Stacy.
You're welcome.
Next, we have action items. The first one is a variance request for the property at 13435 Graf Road, Durango. Bailey, our environmental specialist, Bailey Avenarius will present this. Thank you.
Thank you. So I met with Tyler Dirksen, back in the beginning of March. He resides at 13435 Graf Road. Tyler's wanting to put up a deck that's attached to the front of his house, but does not meet the 10-foot setback. So he is requesting a 6-foot variance from the house to the septic tank.
From the deck to the septic tank or the house to the?
I mean, the deck, I'm sorry, the deck to the septic tank.
Okay. And is that, does that mean then that the deck would be 4 feet from the septic tank?
Right. Okay. Which I mean, from each side, you can still access it for pumpings and stuff. So I mean, I don't see really a problem there, but
I saw in your report or something that you don't think it would, well, you said there'll be access. You don't think there'll be any health problems related to this? And you're basically recommending that we grant the variance, is that true?
yeah.
Okay. All right, any discussion?
It looks and sounds like they can still get in and out without driving over it and stuff like that, right?
Oh,
Footings
yeah.
can be put away.
Yeah, because the driveway is just to the right. I mean, so yeah, they could just drive on the driveway and.
Yeah.
Are you
And
tired?
this is Tyler, yeah, so if you have questions for him.
Yeah, you can ask me anything.
Okay.
And we don't have kids or anything. It's just me and my wife, so there's no extra risk and the person that takes, I have that inspected twice a year, which is way more than is expected. And they said it's in perfect condition. There's no cracks. It's not actually a vault style. It's a different kind of septic system. So it's a very small tank. And they said, actually, I probably will never have to pump it because it's little, with just two people in the house, with as little as it gets used with the way that it's designed. It's got an aerator system in it that makes it decompose quicker. So they said they love doing mine because they're in and out in half an hour. And it's, you know,
Has that system been in there a while?
I think it was installed in 2009, I believe.
Okay.
We bought the property 5 years ago, so.
Okay.
Is there a drain field with that system?
There is, and it runs actually towards the street.
So it wouldn't be under the.
No,
decks?
no. There may, no, there's nothing to do with the septic where I will be building.
And this is just a regular deck uncovered.
There's gonna be a cover, it's gonna be a porch, deck
Porch?
porch, yeah. But the roof line won't extend past the deck either, so.
And so what, do you put posts down in or are you gonna have to?
I'm gonna do footings, yeah. So there will be 4 footings along the front. That'll be 4 foot down to get past the frost wall, that's per zoning. And then, but those are just gonna be piers that just go straight down. And everything will be elevated up off the ground. And then I'm gonna put black bar paper down underneath to kill all the vegetation, put rock down. So all that will be sealed.
I always kind of defer to Adam's expertise. Adam,
No, I mean, I
what's
think,
your-
yeah,
what's
especially
your
with,
advice?
yeah, no, especially with like the footings and you're aware of it, you
Yeah.
won't be driving there and, yeah, no big, trucks driving over it, so it seems to me that it wouldn't be an issue, and it's still set back from the house, so it doesn't seem like it's gonna be disturbed in the process or afterwards. So, yeah, so to me, I agree, yeah, per usual with Bailey's, yeah. I think that's-
Is there a motion to approve this variance?
I'll make it.
Anybody second?
Second.
Okay, it's been moved and seconded that the variance requested for 13435 Graff Road, Durango be approved. Is there any further discussion? Hearing none, we'll take a vote. All those in favor of the motion, say aye. Aye. All those opposed? Hearing no opposition, then the variance is granted and you will have a 4-foot setback, correct?
Yes.
All right. Thank you very much.
Thank you. Appreciate it. Good evening.
You
You
too.
too.
Let us know when the party is. Okay, the next action item, this is the second reading of the Board of Health Governing Body bylaws changes that were suggested by our district person, Becky. So this is the second reading and we have those in front of you today, a copy of those. And then on the very last page, there's just kind of a summary of the changes that we're making. It looks like, yes. Yeah, there you go. So the first thing that we're doing, we're correcting grammatical and typographical errors as indicated throughout. And those are pretty self-explanatory. The next, Article 2, number 3, we're changing to shall. And so it would say, let's see,
On the front.
Here, yeah, right here.
First pink one.
So, the county health director, it said to employ such other, we're gonna change that to shall employ such other staff or positions which have been authorized. And then we're not going to, it was suggested by Becky that we reword, the sentence that's in parentheses, but, I don't think that's necessary unless someone else thinks it is. So that's the second, kind of substantive change that, Article 2, number 3, change to shall. The next change is Article 3 concerning membership, section 1. Let's see. Currently, it says the membership of the Dubuque County Board of Health shall consist of 7 persons. And then we're just adding appointed by the Dubuque County Board of Supervisors, at least one of whom shall be a physician licensed in the state of Iowa. The Becky called it to our attention that the state code actually has changed, and it's not required that a physician licensed in the state of Iowa be a member of the board. The code now reads, at least one member shall be licensed as a physician assistant under chapter 148C, an advanced registered nurse practitioner under chapter 152, or
It's practice registered nurse.
okay, or an advanced practice registered nurse. So that's what the current code now says. So I just wanted to see if there's any discussion. If you want to go ahead and put that change from the code into our bylaws. I personally think we should probably, because right now we have a position, which is wonderful, but if it came to a time when we couldn't recruit a position to be on our board, we have some other options. So, and it is the state code, so we'd be following that. I think we would have the option of saying, no, we still want a position, but I mean, I just wanted to leave it up to the board. Kind of. Any discussion about that?
I like mimicking the Iowa code. I think it,
Okay.
alignment always makes more sense.
Okay.
Extension.
All right.
Is
Go ahead.
position included in here? Like,
Yeah, I think it may be a
Is that
position.
in advance, but yeah, I mean, just in the written part there.
Yeah, Becky didn't write physician, she didn't add physician, but I think physician is still a part of
Mhm.
it can be a position.
I think
Okay.
there's an or after. there.
Okay, that's,
Yeah.
okay, so
Okay, and the next change is Article 3 orientation, section 2. And there was a question whether we want to reword that. So that's Article 3, section 2. Members will serve 3-year terms. Is that what we're talking about?
I think.
Under manual?
Article 4.
Okay.
Can you read what's in the thing?
Are we under section 2 manual?
Yeah.
The pink says, so it would start with new members will receive a new Board of Health member packet. That outlines the Board of Health members' roles and responsibilities. Oh, that is jurisdiction. Open meeting laws.
Okay.
Good eyes, Pat.
This isn't highlighted.
Yeah, mine's not highlighted.
Oh, there you go.
No wonder.
Helpful.
So that's, again, those were Becky's suggestion. That was her suggestion, so I think that is more succinct, and we'll make sure that the new members of the board would get that information, so. Okay,
And that comes from Becky's training, correct?
correct. And then Article 5, officers, section 2. Duties, I don't think we put them as
Yeah,
that.
I just had a question mark over the chair will speak to the public on behalf of the board when so directed by the board.
Yeah.
I think that just means that, well, actually, maybe we would want to change that to the person who's been trained for public information, which would be BIO, yeah.
So remove it altogether from there.
I don't know, that's just a point of discussion.
Yeah, I was reading it and thinking that does the chair require the direction of the board in order to speak publicly?
I have been told that yes.
Don't speak unless the
That
whole
is-
board agrees.
I have been told that's true, that I cannot, that the chairperson should not, or nobody should be out speaking on behalf of the board without the board having said, go do it, so. So I do think that is a requirement. I would think that we might want to, I mean, there are times when I am in the public, as the chair, that I am asked a question or that I do speak, not really on behalf of the board, though. I mean, I guess I would say that we should still leave it in there, but that maybe we would say in the absence of the director or something. Because the director is the official, public the public information officer.
That's what I was just thinking, that,
Yeah.
that maybe that part should be added in.
I would say like in the director's absence. Is that okay with you?
of when directed by the board. Well, I think you'd still be directed by the board to
Yeah.
do it.
Yeah, I think it could read in the director's absence, the chair, and I think it could be may speak to the public on behalf of the board when so directed by the board. So it would be in the director's absence, the chair may speak to the public on behalf of the board when so directed by the board.
Okay, this is just a little bit probably ticky-tacky, but do we want to put public information officer, because isn't Stacy one too? So if Ally wasn't there, then it would go to Stacy and then it would go.
I've had the training, so I don't know that I would ever, unless directed by all of you to speak on behalf of the board, but I have been trained. And so in the eyes of emergency preparedness, I'm on that BIO list.
So instead of saying in the director's absence, say in the public information officer's absence. Okay.
I think that just covers all the bases.
Yeah.
So the apostrophe would be after the S. It's where they went, right?
Right, that's
Right,
true.
Ben?
Yes. Okay, all right, so then, I think, the next and last, thing to look at is Article 6, meetings, Section 4. Okay, this has to do with virtual attendance and voting, as if you're attending by virtual attendance. Right now, it says Section 4 quorum. 4 members of a 7-person board shall constitute a quorum at any board meeting. In the absence of a quorum, the board may be polled, POLLED, by telephone. And we don't really do that, but we might do it. We might have, we do have people vote virtually. So, we thought maybe we should just have some language there where, a board member may vote virtually. Would that be?
And that would include telephone. I mean, it's not like we have that happen, but
Right.
I didn't see if there's a phone in this room that we could do that, but.
Yeah, so I think that would, it would be pretty inclusive. It could be anyway virtually, right? Be by phone or.
You can call it.
Oh, right, that's true.
So as
Right,
long
right,
as
right.
you have a call in.
Mhm.
So who is this question from about that? Unless cutting into a meeting is not going to be best practice.
Calling you,
Becky.
Becky,
Or
or,
unless calling into meetings not going to be best practice.
yeah, I think she
Or
was
that's
just,
her
she
question.
was just calling it to our attention that's with the Open Meetings Act, that's really probably not the best way to have a vote taken. So
And I would agree, except that for the most part, we have quorum. It's not an issue for us, but there could be a time when we would need, so I think it would be good to have that in the bylaws.
I think so too.
But I think it will be the exception rather than the rule.
Yeah.
Just increases accessibility for actually the person has an option to be here or not in person. Or I should say, if they have the option to be here remotely or not at all because they have to be in person, I think we'd rather have them at least call in.
Virtually, yeah.
Mhm.
And I mean, our goal is always to have an in-person quorum also. And so those are really just extra votes, basically, that would be taken virtually. But I can see if we had another public health emergency or something that may be very important to do, so. So, it would read 4 members of a 7-person board shall constitute a quorum at any board meeting. In the absence of a quorum, the board may vote virtually. Okay. All right, those are the only changes. So, what we'd like to do is take a vote on that. So that's why we have the summary kind of written up. I'll make the motion to do the corrections and changes that we have listed and that I've just gone through verbally, the one that's we have listed on this list. So I've moved that.
I'll second.
You second. Is there any further discussion? Hearing none, let's take a vote. All those in favor of the motion to make our corrections and changes to our bylaws, say aye. Aye. Those opposed? Hearing none, then that passes and we'll make those grammatical corrections and changes to our bylaws. Thank you. The next thing on our list here is the monthly budget detail report. So I just wanted to call that to everybody's attention. So it's in the packet, detail VS budget report. I've started getting these monthly and I'm not even sure who's sending them to me. I don't know if it's Stella or I'm not sure because it doesn't say where they're coming from, but I'm getting them at least. So I thought that we should put them with the packet so everybody can kind of take a look at where we are financially. I don't have any comments about it tonight, other than to say that in looking through this, it looks like radon kits were purchased. Does anybody know about one?
We keep them on hand. We
Okay.
sell them.
You sell them? Okay, so that's why we have radon kits.
That would be another great thing to put in the next newsletter.
Yeah, that they're available here, yeah. How much do they cost, you know?
$13.
13, okay. And then I also learned that I think everyone in the department has a notary, they're a notary. So that's great news. And then, let's see, I thought there was one other thing kind of interesting. No, I guess that was it, but, so, very good. Does anyone have any questions or concerns about this budget report? So I think it's for the month of February.
You know, I didn't take a really close look at it ahead of time, but, the first few pages where it's negatives and negatives percentage remaining compared to the last 4 pages would make more sense to me where it looks like you're ticking down the percentage of those line items. I don't know if somebody can explain the negative and negative percentages. Is it
I
because
can't,
it's because we've overdone
You
the
know,
budget, or is it because it has something to do with the program?
I think it has something to do, I don't think we've overspent any
Yeah.
budget. Can I show them to you, Stacy, maybe you,
Laura's got them right here.
okay.
We don't necessarily need to tie up on this,
Yeah.
meeting. It's just something that came to my
And-
attention and looked at.
Yeah, and we actually, we had a little discussion, Ally and I had a discussion about that because neither one of us
Yeah.
understood that. So if we don't get that answered, we will contact, I believe Stella would be able to.
Yeah, we have budgeting software that the accountants understand that puts debits as credits and credits as debits, and I've never seen anything like it before. I'm used to looking at a P&L statement and not
Yeah.
necessarily budget.
Yeah.
So I've never seen, until this is the second time I've seen it.
You've
so,
seen it, yeah. Yeah, I think we'll, do you
I
have?
think, I mean, I can only, because I just know where our grants are and I see
Yeah.
them on here. It looks like every number is negative, so maybe that's just how it's put in there. Because like when you look, for example, physical health grants, immunization and TB. It looks as though it's negative 18,895. That's how much the grant is.
What page is that?
It's on the very front page towards the bottom.
Okay.
And so it looks as though it comes across on this paper that it's a negative. And then the beginning balance is 16,937.86, again, negative. Total activity is the 1540, bringing it up to 18,478 with 416 remaining in the budget, which then looks like a negative
Yeah.
2 point, and I know we're not negative in the grant, I know that for a fact, so I'm assuming maybe it's just the way it's on the
The
report.
way that.
Megan might be able to answer that best,
the
Megan
accounting
Rosella, but
program, yeah. Well, we'll get those questions answered by next month so that we'll be able to intelligently look at these reports. So thank you. All right, any other questions, Mike, or? Okay. All right, next, response to public questions. I did not receive any public questions this month. Did anyone else? Okay, next we have unfinished business, a status update for the enforcement procedure. No, nothing has happened with the enforcement procedure, so, we haven't been able to get any other county's enforcement procedure, which surprises me. And the public health or the state public health, you know, where Becky works, they don't have an attorney assigned to them right now, so. So we haven't been able to, I thought, well, that would be the best way, go with an attorney there, but, they don't have one right now. That position hasn't been filled apparently, so. So we're gonna keep, it's on our radar and we'll try to figure this out some way, so.
Sandra, this is Ann.
I might have to sit down and write it myself. Yes, go ahead.
So just wanted to make everyone aware that the county attorney withdrew from the budget his request for an additional attorney. He felt he needed to participate in budget cuts. So that's he withdrew that. So there we are.
Okay, we won't be waiting for that help then. But we'll continue to try to work on that. I'm not sure why we're starting from scratch on that, so. But we'll try to figure it out. Next, unfinished business, an update on the use of Mercy's mobile unit for vaccines and healthcare needs generally. Does anyone have a report on that?
Allie, you want me to start? So both Allie and I met with Michelle Arnsdorf from the Mercy One Mobile Unit and kind of talked about what was talked about at the Board of Health on finding a partnership with some kind of health event, something that we can do together to really collaborate all of our skill set and take it out into the community. So we met initially on February 22nd and determined that, yes, we would like to find some opportunities to really showcase some collaborations. And so we determined we needed some additional partners. And so we did invite some people from the City of Dubuque, the Neighborhood Prosperity Group, Crescent Community Health Center, a few more people, I think from Mercy joined. And we all kind of met on March 8th and determined and talked about, you know, looking at partnering with some events that are already in place. Maybe looking at joining in some events at the fair, doing something in the city of Dyersville, partnering specifically for like back to school type events. We know the need is there. And so looking at partnering with the back to school bash that happens in August, where children can go in and also get school supplies too. What we are looking to do is offer sports physicals, brain health evaluations, lead testing, immunizations, oral health screenings, I think, and we all kind of have different skill sets that would be willing to partner in both with the mobile unit and with some of our other organizations. So we did determine that we would like to bring in the Multicultural Center to join us in it with some of these, and we'll probably pick up more partners along the way as we realize we may have more need, but we really wanted to stick with smaller events to start with, so we could have multiple events throughout the year and really start by tackling back to school. So we are going to start planning those beginning April 5th. April 5th is our next meeting. And so we'll start looking at which events we want to tackle first and, you know, who can bring what skills to the table and then have these services offered county-wide at different locations throughout, mainly in the fall for this year, and see what else we can do on a more permanent or routine basis going forward from that. Anything you want to add, Ally? Did I summarize it?
No, you did a great job. I just think it kind of boils down to meeting people where they're at. And we have the ability to be able to do that. So it's just kind of, I'm excited for the opportunity. I think
So am I. I think it's gonna be great for the community. It's great for our organizations. It's a good partnership. And it really showcases and prioritizes that we're looking at the health and well-being, starting with children. There's a lot of health need out there. We could go in a lot of different directions, but making this start and then finding those organizations in those events and highlighting them as well. Like, hey, you know, we're on a health basis, we're gonna partner with Back to School Bash, and we're gonna partner with Dubuque County Fair, which brings in a whole different group of people, probably a little bit further out in the county as well. And then looking at our smaller communities too, and bringing those services directly there.
Great. Great, thank you for doing all that. All right, number 11, new business. I have no new business unless anyone else does. Next, we have board communication and reports, and this is the opportunity for any board member to talk. So, anyone want to say anything?
It's being finalized with the Dubuque Area Substance Abuse Coalition is planning a park cleanup at one of Dubuque's parks, sort of like the mobile health unit. It's starting small and hopefully will grow and expand out into the county. But I will have more information on that at the April meeting, but it's a hands-on tangible thing that DASAC is looking forward to getting out into the community and cleaning up one of the parks after winter and before the kids start playing at the park. Another thing, I was invited to Stacy and Ally helped me with this maternal health, I think.
Maternal Health Advisory Committee.
Advisory Committee. I was invited, and so I attended one meeting of that. It was an excellent meeting with people from all over the state. And I was part of the whatever that mobile bus unit, what was that one called? I was part of that meeting as well, so.
Great.
And you know, just so you know, Amy, we have a Child Health Advisory Committee coming up next, so I'll be looking for the email. Perfect.
Well, thank you, Amy, for being involved like that. We appreciate that. It's good for the health department.
I just share, and I don't want to see Janae Schmidt, who is our executive director for our A New Day walk-in clinic on our campus. It's also referred to as the local access hub for the county. Don't want to steal her thunder. I think she's going to take a few minutes during public comments to give some updates about A New Day. I know that Ally and Amy and others at different times have toured through, and so they know the facility that Janae is going to give a little bit of an update on. But we are speaking, I think, at a few different locations in the course of this week. The Chuck Eisner, the event that Clark, that Ann mentioned, we plan on going there and listening, as well as we have an opportunity just to speak about mental health and the crisis of mental health, which is a public health issue, especially as it relates to what is a pent-up demand coming out of COVID that's putting pressure on the emergency departments as well as law enforcement, both sheriff and city police, and the jail system. The walk-in center, which Janae will comment on, helps to bring some relief to that, because it's an alternative to what is often not the most appropriate place to seek care for people that are uninsured or underinsured, especially when they're presenting with a mental and behavioral health issue and not necessarily a medical or emergency or a criminal type of situation. So won't steal any more thunder on that from her, but want to get my 2 cents on that.
Thank you, Mike. Okay. Anything? All right, well, very good. I appreciate the hard work all of you board members are doing. Next, our next regularly scheduled meeting is April 19th, 2023 at 4:30. At this time, anyone may address the board on matters of which are of concern to that person and which are not agenda items. Please raise your hand if you're on Zoom, or raise your hand if you're here in the room. State your name and home address. Please be aware that the board is limited in their ability to respond to such inquiries, and the Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. Individual remarks are limited to 3 minutes. Hi, we do have a hand. You can go ahead, Janae.
Hello, everybody. Can you
Hi.
guys hear me?
Yes, we can.
Wonderful. As Mike said, my name is Janae Schmidt. I work with Hillcrest Family Services. My home address is 2016 Dock Street in Dubuque, Iowa, 52001. As Mike said, I was just coming to give some updates and some comments today related to A New Day. As Mike said, I've met some of you folks in the room, but I believe that the Board of Health is a massive stakeholder, quite a big stakeholder in how we continue to build wellness in our community. And so I love collaborating with each of you to be able to have conversation, especially related to A New Day. With A New Day, for those of you who haven't been to the center, as Mike was saying, is a walk-in crisis and navigation center for folks who are experiencing brain health and substance use concerns. We opened back in August of 2020. And since that time, we've served over 4,000 patients inside 7,000 unique service encounters. And we believe that within the next year, as we go into our next fiscal year, we will see a 20% increase in the number of folks that we have served and how we have served those folks. Based on our projections, it seems that, we have done quite a bit to, again, help alleviate the folks like our partners at hospitals and jail settings, as Mike was saying, with law enforcement. But we do believe that there's going to be a continued demand, as there is a significant pent-up overtime crisis related to behavioral health. Even prior to the pandemic, behavioral health was a public health crisis. And so we know that it's going to continue into that, especially related to COVID. And earlier I heard you guys talking about eligibility and the coverage in our community. And that's actually something that we work with our clients who walk into the center to do as well. As we go forward, I just wanted to, bring this to everybody. You're always welcome to come into A New Day to see what we do, to see how we do it. We're always welcome to show anybody kind of what it looks like. One of the things I'm going to drop in the chat here for everybody is a packet in which it talks about the success, our crisis of success that we've had over the year, right? We've seen such a demand of behavioral health services and needs. And I hear that in the conversations we're having. I believe Stacy, earlier you were talking about the back to school bash Hillcrest has been a part of before. And so, we've just seen such a beautiful success inside of A New Day, and we know that that will continue. And it's vital that it continues for our community. So just wanted to come in and give an update to the board related to those matters.
Thanks, Janae. I guess I've taken over as chair. So Sandra had to leave. But thank you. And I will entertain a motion to adjourn. We don't need a second. Oh,
Amy, I just have a question for Janae. Is that okay?
I think privately it's okay, but I don't think we can do it in the public forum because it's not on the agenda. So I will entertain a motion for adjournment, and it doesn't need a second because we are a public entity. So motion to adjourn the meeting. Okay, motion is that the meeting is adjourned, and the meeting is adjourned at 5:34. Allie, and I forgot my sheet. Allie, it's on my desk at home. I printed it out thinking I thank you.
You may help every.